Hi guys, it's Tara Scott with Revitalize. So yesterday I saw a patient who made a comment to me that made me think, and I wanted to make a video. So she said, oh, when I look at you, I think about perfection, and I think your health is so great and you've got everything figured out. And I just laughed because nothing could be further from the truth. Yes, I do have good health, but it's all because of the changes I've made with functional medicine. If you guys would have known me 20 years ago, I was eating hamburger helper, processed food, takeout, a lot of things. But everybody has a reason or a processor that they turn to functional medicine. So I'm so excited to share my webinar that is finally ready. So I'm going to post the link below. You can sign up to watch it. It's about 50 minutes, so you need to set aside time, but you can see my story and see how functional medicine has changed the way I practice medicine, the way I practice gynecology, and the way I take care of myself and my family. So I'm super excited that this is ready. I've been working on it for probably about 4 or 5 months, and it's finally ready. So take a look and pass this on to somebody who you think needs to watch it. So what are the risks of taking estradiol? If you're taking estradiol, that is what is exactly made in our body. Estrone is another type of estrogen that's converted in your muscle and fat from your adrenal gland after you go through menopause. So the types of estrogen matter, and what you take matters. And so the type of estrogen that was studied and showed an increased risk of breast cancer was more like estrone. That estrogen has a tendency to cause growth of the breast tissue and the uterine tissue, whereas estradiol doesn't seem to stimulate the breast growth quite as much, even though it is a stronger estrogen. They actually did studies on women who were on the treadmill, and they saw that they had EKG changes suggesting heart problems. And they gave them an estrogen patch, and they had a resolution of the symptoms and improvement, just as if they gave them something like nitroglycerin. So we know estrogen helps the heart, and it has a favorable effect on your cholesterol if you don't take it as a pill. If you take it as a pill, it can increase it's inflammatory, and it can increase your markers and your triglycerides. So the thing about estrogen is we also know that it helps your bones. And osteoporosis is a big problem. So the death rate for osteoporosis is higher 2 years after a hip fracture compared to 10 years after a breast cancer diagnosis. But everybody fears cancer the most. So the problem is the type of estrogen you take, the amount you take, the dose you take, it needs to be monitored correctly. We need to see what your body is producing, and you need to take a form of estrogen that is identical to what's produced in your body. So I think that's why we've had a lot of problems with estrogen. It's not so much that nobody should take it and it's bad, it's just that we didn't individualize the therapy. So patients need to know what their risks are, what their levels are, and they need to be prescribed a type of estrogen that's taken through the skin and is also not going to raise their estrone levels as well. So I think that if you approach it this way and you personalize estrogen, then we can minimize the risks given from giving it. This is Tara Scott from Revitalize. I think as a functional medicine provider, you have to walk the walk and talk the talk. We have to lead by examples to our patients so they can see the benefit of preventative health, and also so they can know that we understand the struggles of a restricted diet, of eating gluten-free, or that we've been through, because all of us have a turning point that we have either a personal experience with functional medicine or someone in our family does, which makes us turn to functional medicine. So I've compiled a video to show what a typical day is like for me. So take a look. So my day usually starts pretty early. And this particular day, my alarm went off at 5:30 in the morning. Usually I have to get up, take my thyroid medicine, and let it sit for a while. Then I always love to drink this pre-workout energizer. It's really good for focus, and it doesn't have any stimulants in it. Love to put a load of laundry in prior to exercise, because then it's done in the washer when I get back. And then I went on my morning run with my friend Donna. If I run more than an hour, or I'm particularly dehydrated, or I lift, I usually follow with a recovery drink that has protein in. And you want to get that in within the first 90 minutes. And then after that, as I'm getting ready for work, I take my morning supplements. And then I make my shake every day. Usually starts with filtered water. And I've been doing these pre-made shakes from Raw Trainer this week, just for a little variety, but there's usually some kind of ingredient in there. And then I add my own concoction. So I'm putting a scoop of fiber in it, and a scoop of glutamine, which is good for healing the stomach. And I rotate collagen protein, which is whey, with egg white protein, and goat milk protein is what I've been using right now. On the days that I don't exercise, I do intermittent fasting, and I've been doing a 30-day trial with this Organo Gold coffee that has reishi mushroom in it. It's supposed to be really great for inflammation. And I just put a little coconut creamer in it.
When you're ready, just take some nice deep breaths before settling into the space around you.
There's a lot of administrative things that need to be done, and this particular day I had a Facebook Live that I had to record. I usually take my lunch from Raw Trainer, so it's a healthy salad, and it's convenient because it's already made for me. And most of my day is spent talking to patients and going over test results and getting to the root cause of what's going on, helping them feel better and feel hope. When I get home, it's time to cook dinner, and I generally try to cook 4 times a week and have a family dinner. This particular day, it's roasted root vegetables, salmon, and quinoa and rice. My husband was working that night, so he wasn't there. After cleaning up the kitchen, then, I unfortunately oftentimes have to go back right to my computer to finish up the work and the charting from the day and answering patient messages. Time for bed, I have a ritual of starting my diffuser, which is either lavender or serenity, to help calm me down from sleep. And then it's time to take my supplements at night. I love this Adrenal Calm cream that is essential oil blend, as well as things for your adrenal gland to calm you down. It's really great for sleep. Hey, it's Tara Scott from Revitalize. So yesterday I saw a couple new patients that really got me thinking about the whole functional approach to women's health. And I see patients all the time that either have had a hysterectomy or have had an endometrial ablation or have had heavy periods or fibroids, and they haven't really gotten to the root cause. So in traditional medicine, we make sure it's not cancer, and then the options are to treat you. Let's give you birth control pills. Let's cut it out. Let's do these things. And then these people have hysterectomies and procedures, but we haven't gotten to the cause. So you're still left with the hormonal imbalance. You're still left possibly not getting rid of estrogen. You're still left with genetic predispositions to having problems with your thyroid, your gut, your hormones. So then they still struggle, and certain things are better. Certainly the bleeding is gone when you remove the uterus, but they're still not a fix and a root cause. So I'm super excited that I finally have recorded my webinar, A Functional Approach to Women's Health. So you can watch this. It's about 50 minutes, and it sort of goes through a lot of gynecological problems that unfortunately, I have actually experienced myself. I've cured my endometriosis. I had infertility. There's a lot of things that I had, and I just laid it out on a 50-minute webinar. So hopefully you will have the time to watch it. All you have to do is register. You can pass on the link to somebody who you think needs to watch it. And so hopefully by treating women this way, maybe we can avoid unnecessary procedures, but maybe we can nip problems in the bud by treating the cause. So I hope you're having a great day. Hi, it's Tara Scott from Revitalize. So today I want to talk a little bit about types of testing for hormones, because there are a lot of different opinions and there's a lot of confusions, because some patients come in and they say, my doctor only did blood tests. And some patients come in and say, my doctor only did saliva tests. So I wanted to kind of go through the different types of testing and why we do what we do. At Revitalize, we do all types of testing. We do blood testing, traditional testing, saliva testing, we do urine testing, and we do something called blood spot testing, which is when you prick your finger. So how do you know what you need? Well, all of them measure different types of things, so it depends on what we're trying to figure out. So for example, if I'm a census taker and I want to come to your home and count to see how many people live there, if I come in and I see you and your husband sitting there in the kitchen, I say, there's 2 people that live here. But I don't know that you've got 2 kids upstairs in the bedroom and 1 away at college. So I really haven't accurately assessed the population. I'm not looking in the right place. I'm looking only in the kitchen where there's people in the bedroom. So that's like blood is only one compartment. Blood is the highway. Blood carries things from one place to another, but that's not where your hormones work. So certain hormones are good to measure in the blood, like the brain hormones, like your TSH or your FSH, because we want to know what's going on, and we obviously can't reach your brain, so we got to see what the hormone levels are in your blood. As well, we can measure your sodium and your potassium and your copper levels and your zinc levels. We can also measure your cholesterol and your sugar in your blood. Now, if we wanted to look at the nutrients, we'd have to look at what's inside the cell, not outside of the cell. When you draw blood testing, the first thing they do is spin off the red blood cells and throw them out. So that's another reason why blood testing can often be inaccurate for hormone levels, because if you have ovaries and you're making hormones, then those hormones are going into the blood. But if you're someone who's had a hysterectomy and you don't have ovaries, you're not going to be able to accurately see what your body's making, because your hormones are coming from your adrenal gland. They're being converted in your muscle and fat to a different type of hormone, and that's where your body is getting it. So by checking the blood, I'm going to miss it. That'd be like saying my 16-year-old daughter is leaving my house every morning in sweats, so she must be a good kid. But as soon as she gets to high school, she's putting on a tank top and a miniskirt. I'm not seeing her change her clothes when she left the house. Certain hormones change into other things in your cells, so by doing blood tests, we're going to miss that conversion. So that's why a lot of times we like to do saliva testing. Saliva testing is best to look at your cortisol levels and to look if you're using a topical hormone for women. The other type of testing we do is urine testing. So urine testing would be if we wanted to see what your body did to the hormone and how your body used it. So a lot of times we like to look at the urine metabolites. Think of it as if I'm a tax accountant. I'm looking at all your receipts. I don't need to watch you buying things or watch you purchasing, making purchase or paying your bills. I just need to see the receipts so I can make some kind of meaningful evaluation. So a urine test is looking at what's leaving your body so I can extrapolate how is your body metabolizing hormones, are you stockpiling them, and if I wanted to look at your blood spot testing, I'd prick your finger, I'm going to see what's in your tissue right now. That's whole blood, so that's accurate for a diabetic to measure his glucose. That's also an accurate way to look at some hormone levels as well, as long as you're using some topical hormones. So there's a lot of debates, even among doctors, as to what types of testing is the right way to test. But I would say we do all of it. We personalize it to make sure we're getting the right testing that you need. So if you're someone who's interested in hormones or taking hormone therapy, make sure that your doctor is checking the right kind of testing for what you're taking. Hi, it's Dr. Tara Scott with Revitalize Medical Group. We've been talking about treatments for the adrenal gland, and today I want to talk about sleep. This is the other thing that I really had to change when I discovered that I had a sluggish adrenal gland. After years of delivering babies and working night shifts and working 36 hours a row at all hours of the night, I really killed my adrenal glands. And so what I found was I'd be working all night up delivering babies, and the next day I had problems falling asleep. I was tired but wired. So I began to take less call and eventually stop delivering babies because I just couldn't take the being up at night. I became very strict about my bedtime, and I found that if I didn't go to bed before 10:30 at night, I had a problem falling asleep. The reason this is important is because your cortisol will start to rise. And so if you go to bed at 11:30 or 12, all of a sudden your cortisol is going up and you start having more energy. And so you're tired and wired. So if you can get to bed before that spike, you're going to sleep a little bit better. And the other thing I noticed is that if I didn't get to bed early enough, I would always wake up early, like at 4 a.m. And so that is when your cortisol starts to rise for the morning again. So you really want to have a good anchor of sleep prior to that. And there are supplements that can help you sleep. One good one I like is called L-theanine, and that is very safe. There's very little drug-drug interactions with that, and that is really good if your mind is racing and songs are going through your head and you're tossing and turning. It doesn't sedate you. It just helps to change the brainwaves into a more creative, relaxed brainwave. And so you could take 200 milligrams of that. The other supplement that I really like to take is melatonin. Melatonin is safe anywhere from 1 to 3 milligrams. For me, I love the sublingual dosing that melts on your tongue, and it kind of like, I'm like Pavlov's dog. I get that, pill in my mouth, it starts to melt, and then I'm instantly drowsy. So for me, it really works. But you want to keep that to 1 to 3 milligrams. And just make sure you protect the hours that you're in bed and give your body enough sleep. Hi, it's Tara Scott with Revitalize. Somebody asked me to talk about why energy decreases over age 40 for women. So there's a couple reasons. Aging is a normal part of life, but for women, 40 isn't really the beginning of the end. Menopause is until age 52, and so I have some patients who feel great, even in their 50s and 60s. So what is the secret to energy? It's not a quick fix, unfortunately. It's a lot of different things it could be. The biggest reason is that we do see a decline in your estrogen and progesterone production. You're born with so many good eggs. Your body preferentially will release the good eggs first. And so when you get to be 40, we know that there's an increased risk of chromosomal problems and decreased fertility. We're not really concerned about fertility at this point, but it would translate that if they're not good enough eggs to have good quality children, then maybe they're not as good hormone production. So if there's not as much estrogen, or certainly estrogen without the complementary progesterone, your energy is going to go down because that affects your sleep. One of the other things that has a big deal to do with your energy is your androgen levels. And so androgen are hormones that are not estrogen and progesterone, but those are things like DHEA and testosterone. Both of those hormones are made sort of independently of ovulation, and even independently of whether you have ovaries or not. Those hormones are highest in your teens and 20s, and they gently slope down until 70s and 80s. So it's not supposed to be a steep drop-off when you're 40 or 50 or at the time of menopause. Research has shown that stress accelerates that decrease. So in our 24/7 world, I see a lot of women who have an increased stress, and so that's depleting their androgen levels. So a proper hormone evaluation shouldn't just be about your estrogen or even your estrogen progesterone, but also your testosterone and your DHEA. The other thing that can affect your energy levels is cortisol. So cortisol can go up and down depending on stress. Low cortisol can cause you to have low energy. High cortisol can disrupt your sleep and can cause you to have low energy. So those are things that need to be investigated by saliva testing to see if that's the problem of your low energy. And the last thing is thyroid. It could just be that thyroid disease is common in women over 40, the most common thing being autoimmune thyroiditis or Hashimoto's. But the thing is that your estrogen levels, whether they're too high or too low, can affect your thyroid and your cortisol levels. So those common things that happen can make your thyroid sluggish, and maybe it's not really abnormal, but maybe it's just not working as well as it will. And the main cause is not your thyroid, but it's your estrogen levels and progesterone balance and your cortisol. So everything's really, really like a symphony. It has to all work correctly. So usually those are one of the things that cause it. So again, the answer is to get with a hormone specialist and get the proper testing. But a lot of these things can be fixed, some of them just with supplements, dietary changes, and lifestyle changes. Some of them need to get replacement hormones prescribed. Hi, it's Tara Scott from Revitalize. So there's a lot of controversy about hormone therapy, and I'm going to make a few videos to address that. So the biggest thing is, should all women take hormone therapy? And I would say that absolutely, I would say the answer is no to that. We can't make a blanket statement like that for everybody. And one of the things that we do in functional medicine is make it personalized. I think what's important is to know what your hormone levels are. So for example, I see a lot of patients that have their ovaries removed and have a hysterectomy, but their bodies are still able to make estrogen through sources like their adrenal gland after menopause. So they don't need to take any estrogen. And by giving estrogen to everybody, no matter if they need it or not, I think that's where we got into trouble with the study that showed that estrogen causes an increased risk of cancer. So I think the biggest thing that I would advocate is that you should know what your hormone levels are, whether it's during perimenopause and you're having fluctuating levels of high estrogen. That can be dangerous because estrogen causes growth in tissues like the uterus and the breast. And without the proper amount of balancing hormone progesterone, an increase in growth can lead to cancer. So what I think is important is for women to know their levels, to be tested the correct way, and then make a decision whether or not they should take hormones. Hi, it's Tara Scott from Revitalize Medical Group. What are the things that you absolutely must do before trying to get pregnant? Well, I'm going to talk about that today. The first thing is you really should consider a detox. There was a study that the Environmental Work Group did in 2005 where they actually collected umbilical cord blood from ladies after they delivered, and there was something like 280 toxins that were present in the uterus. We used to think that the placenta was a barrier and didn't let these things get in and things couldn't cross the placenta. But now we're seeing that a lot of these studies are looking at the levels of toxins for adults, not for babies. And so the amount that is going to make a difference is going to be a lot higher when you're talking about an unborn fetus. So we really advocate doing a detoxification, and that's usually some kind of plan that either has some supplements that can actually get those toxins out of your fat cells and do them. So those are one thing you want to talk with the provider. The second thing that you must think about is nutrient evaluation. I recently was watching a video on ADHD and autism and found out that nutrient deficiencies could be linked to an increased risk of autism. And that was something that I really didn't know, being that I'm not in pediatrics, I don't keep up on that literature. But that did tell me that I should really think about all the pregnant moms or the people who are of a childbearing age. So specific nutrient testing can tell you if you have a selenium or a zinc deficiency or maybe omega-3 fatty acid. And I know that if you're wanting to conceive, you want to be your optimal self. Well, routine traditional lab tests don't necessarily get these levels because you need to get what's in the cell, not what's outside of the cell. And serum testing tests what's outside of the cell instead of what's in the cell. The third thing you should consider testing for is to see if you have any genetic problems with folate metabolism. I'm sure you've heard of MTHFR. Well, the studies have been conflicted going back and forth. And when I was a resident, and certainly when I was delivering a lot of babies, at first we were testing everyone for MTHFR, and we gave everyone high-dose folic acid. And then the studies came out that this high-dose folic acid wasn't really making a difference as far as miscarriage. It may have been for neural tube defect. But come to find out that if you have the MTHFR mutation, there are problems with your metabolism such that you cannot turn synthetic folic acid into the active folate that your body needs. So anytime these women were supplemented with high-dose folic acid, of course it didn't make a difference in the fetuses or in whether or not they had a miscarriage. So that's one thing that you need active folate for. I carry 3 copies out of 4 of a mutated gene of MTHFR, and unfortunately I also had a miscarriage because I didn't know this at the time, and I struggled with infertility for a long time before I got any of my kids, and I had to take drugs to get pregnant with any of them. So I'm just hoping that you'll hear this if you're somebody that's thinking about getting pregnant, and think about investigating these 3 things. We're at Revitalize, we can help you with the specified testing to look at any of these things and get you all tuned up and ready to conceive so you can have your best possible pregnancy and your best possible baby.